Good morning. I want to take this opportunity to thank Dr. Frank Manginello for his many years of volunteering as the chair of our FIMR chart review committee. We have him today to ask him a few questions and acknowledge his service. How are you doing today?
Thank you. Good morning. How are you? I'm doing great.
Thank you so much. So, Dr. Manginello, in your amazing career as a neonatologist, you took care of babies in very high-risk situations. What drew you to this career?
So I love answering this question, Liliana. When I was a senior in college, just transitioning from basic science into pre-med, my landlord was the director of the neonatal intensive care unit at Georgetown Hospital. So he actually brought me by to see this very new science in 1968. And I was just fascinated by the acute care, the chronic care, the developmental work, the family interactions, the research. So going into medical school, I knew what I wanted to be. So I was like light years ahead of all my classmates.
So yeah, passion, it starts with that. So I'm wondering, what's the biggest lesson you've learned in working with families?
You know, I've learned these things gradually over the years, but I first realized that when a mom has delivered and I'm going in to see them on the same day or the following morning, the mom is almost always in bed. I hate standing up and looking down at people, so I'd always pull up a chair, sit down, and be at eye level with the mom. I would introduce myself and say, "What questions do you have?" So I learned very early to shut my mouth, open up my ears, and just listen to the stories that people had to tell. Once you heard them, then you can figure out how you had to interact.
Excellent. Thank you so much. So you've given your time to chair our fetal infant mortality review committee. And it's, as we know, it's not a job that many people would raise their hand to do. So why were you willing to take on this role?
Well, number one, Elise Zimmerman and I were friends for a long time. So she asked, and I certainly said yes. Plus, I knew working in New Jersey, looking at both fetal and maternal mortalities, that there was an awful lot of work to do. So looking at the science, looking at the community, looking at education and how we could provide help through the consortium, now the partnership, through physicians, through churches, through local organizations, was just going to be meaningful, not for me, but for the entire community.
Excellent. Thank you so much. So can you tell us a little bit, why is the fetal infant mortality review program so important? What impact does it make?
You know, we try to improve outcomes. So whether that's by holding educational programs for physicians, social workers, and medical staff, whether it's going directly to the families and having them learn what to expect during the course of a pregnancy, whether it's reviewing all the death data and trying to come up with reasons that we can avoid this in the future. I mean, every aspect of it is good for our community. I mean, we in the United States, unfortunately, don't have some of the best fetal outcomes in the world. So there was an awful lot to do.
Yes, I know. So we made the transition to the new chair for our committee. So I'm just wondering, what advice would you give to the next chair of the committee?
Well, as you know, the new chair or co-chairs are old friends of mine. And what I advised them was to read the cases very carefully and listen to all of the consultants that are at the table with you. Because there's a lot of very smart people out there, people that are involved in every aspect of care, and they all have very good information to give. So know the case, but you don't have to do everything yourself. There's an awful lot of good help out there.
And the last question I have for you, in your role as a physician, you've witnessed great joy, but also sorrow of families coping with loss. What advice would you give to parents who have suffered the loss of a fetus or an infant?
Again, I think you just have to first listen. You may have to share a tear with somebody, certainly offer your understanding and the help of any support groups are out there. I think one of the worst things that you can say is, I'm sorry, you can try again, because that's not what someone wants to hear. But you have to be willing to understand their loss, listen to them, what it means to them, and help them get through this initial phase. The other part that's important is I've seen too many tragedies a year after a fetal or infant loss. So getting in touch with someone 11 months after they've had a loss to make sure they're doing okay, because the anniversary of a loss can be more difficult than the loss itself. So making sure that they're okay at that 1 year mark is really, really important.
Thank you so much. We appreciate your support for many years. A big thank you to you. We wish you happy retirement. I hope you have fun, and I hope you continue to support us, to follow the partnership, to come to our events. We will welcome you anytime. Thank you so much,
I'd
Dr.
love to.
Manginello.
It's been a wonderful almost 30 years. I've learned something at every point in time through this entire journey. So it's been enjoyable for me. Thanks, Liliana.
Thank you so much.